Couldn't have been nicer. I've no complaint at all. Both the car, the nurses and doctors, everybody worked there. I thought it was great.
I'm over the moon. Been brilliant. The nurses have been champion, as I was saying earlier on. You know, everybody's been good. Good care, good everything.
I have nothing but praise for the Trust team.
So when you have someone that will sit and talk to you, take the time, his team are absolutely fantastic. They look after you as a whole person, mind and body, and that makes a huge difference.
What we've decided to do, and many trusts will be following, is to co-locate both the operating theatre and the interventional suite in one area. Essentially, this is both an operating theatre and a fixed imaging centre, all co-located in one area, and that's very unusual. In most hospitals, you would have an imaging facility in X-ray, which is separate from the operating theatre, and then you would have a dedicated operating theatre suite.
ISIS is the term for the Integrated Short-Term Intervention Service, and it's a range of services that have been developed to support people to remain at home or to minimise their length of stay in hospital.
There are three really important changes that patients are benefiting from and are very obvious when you walk into the department. The first thing is the lighting. It is much better. The second thing is the improved signage. It's much easier for patients to navigate their way around. And then the third most important thing that patients notice is the improved seating. It's colour-coded, so patients know which area they need to be in. It's also more comfortable than the seating we had previously. There are chairs included for bariatric patients and for patients with mobility and transferring problems, so there's raised seating available. And all of these are things that we didn't have in the past and are really important improvements.
Well, raising awareness amongst the general public is really important, because there may be people suffering in silence, possibly because they're reticent to talk about symptoms that are embarrassing, or perhaps they think there isn't much that can be done.
We had a lot of problems in the department with flow, and the pressures have been increasing year on year. And I think this was an opportunity where we could actually get in there and make some changes, you know, on the shop floor level.
The prevention of unnecessary admissions onto the hospital floor, quick turnover of diagnostics results, instant access to the surgical review for the GP, something that possibly might have taken a little bit longer before this unit was set up. Availability of scans for patients that GPs would take a good couple of weeks to get hold of if they were going through them.
The top performers in the North East for healthcare acquired infections.
We were top in the region for staph flu vaccination rates.
We were ranked second nationally in the CQC maternity survey.
We achieved NHSLA Level 2.
We continue to improve our scores on the National Inpatient Survey and National Staff Survey.
And we continue to develop our services.
being able to deliver the service, the seamless service I want to deliver, it's very pleasing.
It's an exciting time. The emphasis now is they're transferring the care over to us and much more of a pull approach to that care and a much more coordinated journey for the patient and a better patient experience.
It's just a massively important thing that we continue to turn heads and change minds.
We do have to listen to our service users and work imaginatively with our partners in the third sector as well to achieve the best results.
The most important thing is that the people who are actually part of this whole process, they are very motivated, they are very passionate about that we do implement the system.
There's still some gaps there in the system, but that's what ultimately in that we provide this care 24/7.
So everyone's working with us, and that's important because we couldn't do it on our own. It's a team effort, partnership.